I really want to do a mental reframe for people here. And the first thing I want to start with is there are many natural products that are used for cancer, many of them. A large number of the chemo treatments come from a natural product. They either are still a natural product or they're a slightly modified natural product. Taxol, vincristine, vinblastine, doxorubicin, there are a number of drugs that were discovered in the natural world and then turned into chemo treatments. And so yes, there are natural products that are very useful for treating cancer. One of the things I think people miss is not just this piece of if it's natural, it must be easier for your system or better for you. That is clearly not true. I mean, some of those drugs, Taxol, hard to tolerate. Vincristine, vinblastine, doxorubicin, they're all hard to tolerate. Those are some of the chemo drugs that people have the hardest time with. Hello, and welcome to Elevating Cancer Treatment, where we explain the science and debunk myths to help you navigate your health journey. I'm Dr. Chaplin. An important reminder, I'm a PhD, not an MD. The information in this video is education, and it's not medical advice. Every cancer is unique, and no general information applies to everyone. If that sounds interesting, make sure to like this video, subscribe to the channel, and hit that notification bell so you never miss an update. And two quick things. First, as a thank you for being here, I've created a free resource, 10 Things to Elevate Your Chemo Journey, which you can download from the link below. And second, by signing up, you'll also get updates on that innovative cancer treatment I'm working on. So that idea that natural is easier on your system or gentler on your system is actually completely false. The other thing is that there's this idea that these natural products can target the cancer, that they're selective, and that's not true. Those natural products make good chemo drugs because they target your cells. And I think what people need to remember, again, we talked about this in the episode, What is Cancer? Cancer cells are almost identical to every other cell in your body. There are some changes. It may be 4, it may be 10,000, but that's still very small compared to the 250,000 proteins that make up your cells. There's a small number of differences between the cancer and the rest of your cells. And these natural products, they're good chemo drugs in that they hit your entire body and they'll go after fast dividing cells. But none of the natural products are what we would call targeted therapies, things that are very specific to the cancer. They're not selective. There are no targeted therapies based on a natural product. There are no natural products that just hit the cancer. The natural products that we have that are used to treat cancer are chemo drugs. They're no more gentle than other chemo drugs. They're no more potent than other chemo drugs. They're no easier to tolerate than other chemo drugs. If a natural product works to treat cancer, it is a chemo drug and will behave like other chemo drugs. There's no selectivity for the cancer there. That is something that I think people really need to wrap their heads around because, again, there's this story that if it's natural, it's more gentle, it's better, it's easier somehow. And that is clearly not true. The data shows the exact opposite. The natural product-derived cancer treatments that we have are chemo drugs and are just as hard to tolerate, if not more damaging, than other chemo drugs. Selective. It's harder to make them selective. The true chemical synthesis, when medical researchers, when oncologists take changed proteins that are specific to a cancer and build a drug from scratch to target that thing, when they make a targeted therapy, the therapeutic window is much bigger. The therapeutic window is the difference between the minimum amount you need to have the effect that you're going for to kill the cancer and the level that's going to cause poisoning to the rest of your body. there's a range. You don't want to give so little that it doesn't do what you want it to do, and you don't want to give so much that you end up poisoning yourself. So there's only this little window in here. The natural products have a small therapeutic window. There's very little difference between them treating the cancer and killing you, because they're not built for that. They're not built for the cancer. When we synthesize a drug specific to a change in the cancer, it has a much larger therapeutic window because it's only going after something in the cancer. And so it takes much more to make the rest of your body sick. Those are targeted therapies. There are no natural product targeted therapies. I'm sorry. There are no natural product targeted therapies. Does that mean that there aren't natural products that can be helpful to you? No, absolutely not. Again, many chemo drugs are derived from natural products. There are natural products that you can buy that might help you with your cancer, depending on the specifics of your situation. But natural products, while they can be very useful, at best are just like other chemo drugs. Let me ask you, what natural products do you want to know about? What have you heard about? And it's not just natural products. What other therapies? We're about to do an episode on ivermectin. We're going to do one on febendazole. I'm going to do one on artemisinin. There are a number of others. Let us know what you want to know about. Beyond these videos, if you need more personalized guidance or a deeper dive into specific treatments to have your treatment be as effective as possible, I offer one-on-one sessions and medical advocacy. If you found this video informative, please give it a thumbs up, click the notification bell, and subscribe to our channel for more science-based cancer insights.